Hello everyone, you are welcome to this presentation this evening, and I trust you had a very good day. Happy Monday, happy new week. From wherever you are joining or watching from, this is Dynamic Health and Wellness with Juliet, and it's a place we talk about all aspects of our health. And should the case you are coming across this page for the first time or this video, this is where we address all issues concerning women's health and how they can naturally live a fulfilled life in a natural way. So this morning we are going to be looking at the causes of recurrent UTIs. UTIs is a urinary tract infection, and if you are one or a person that is normally prone to this recurrent UTI, you can head them off before they can take hold of you. Unless you are in the minority group of women who has never had this urinary tract infection. Definitely, if you have had this infection before, you know very well how the symptom is. And you might feel a frequent urgency to urinate. And why this urgently come, behold, you are going to pass out just a little urine when you get to the bathroom. And your urine sometimes might be cloudy, bloody, and somehow have a strong smell, because about 25 to 30% of women who have this urinary tract infection have this infection sometimes return. It returns within 6 months. Sometimes when you talk of this recurrent UTI, it's a kind of infection that normally return, or you have it maybe 3 or more times in a year, or 2 or more times in 6 months. So this is what is called recurrent UTI. So if you have this repeated UTI, you have experienced a kind of thoughts that it has on your life. So, however, you may take some comforts in knowing that they are not likely to be the result of anything that you have done wrong, or make a kind of assumption that recurrent UTI are due to poor hygiene. No, or maybe something that a woman have done to brought upon herself. No. So some women are just prone to this UTI naturally due to some certain factors. So a urinary tract infection is the invasion of the urinary tract, which is urethra, bladder, and the kidney, with bacteria. And these bacteria, they causes the symptoms. So those symptoms will depend on the part of the urinary tract that is involved, whether in the urethra, whether in the kidney, or wherever. So for the purpose of this broadcast, we are going to be considering the infection in the bladder, commonly known as cystitis. So these cystitis symptoms you may have experienced with a UTI may include some of the symptoms like a need to frequently pass out urine. Also, you can also have the symptom like an inability to hold your urine, with a feeling of needing to pass them out urgently. And also another symptom, a feeling of burning or hot sensation or stinging in the water pipe, which is the urethra. That is where you are passing out urine at the end of the urine passing out. Sometimes you may also experience or notice that the urine become cloudy and foamy, sometimes smell or even stained with blood. So if you had a mild infection, it can often clear up within a few days, because most women have the mild UTI, and which does not even need any antibiotic to clear it off. They just ward off on their own. but the most severe infection will probably require treatment. The good news is that there are a lot of things which you can do, as well as also cooperating with your pharmacist to practice some of those things that can help you to manage this condition. However, if you experience a blood in the urine, no, without any other symptoms that we have highlighted above, you need to make sure that you talk to your GP urgently so that they can arrange and to investigate what aspect of your urinary tract that is being affected. So why do women get this urinary tract often? Why this recurrent UTI in women? In a woman, there are only a short distance in the water pipe, which is the urethra, and the back package, the anus. So the most common bacteria that normally cause this UTI is the E. coli. These bacteria ordinarily they live inside our colon because our body are made up of millions of bacteria, both the healthy and the bad bacteria. And so these E. coli live in our colon, and they are also essential in keeping our colon healthy. So these bacteria from the colons, they are often spread when people open their bowel. And because the water pipe is so close that this can lead to the bacteria gaining access into the urinary tract. So the body of a woman, or every human, our body has our own defense mechanism. And this mechanism try to stop this action from taking place or happening. So vaginal secretion, this secretion, they are very rich in healthy bacteria which help to keep our vaginal pH in a constant environment, and also they also help to stop this chronic E. coli from reaching the water pipe. So common things like sexual intercourse, during sexual intercourse, or constipation and urinary or bowel incontinence, all this can increase the risk of having a UTI by either disrupting the vaginal secretion, which is the healthy bacteria, and also by allowing the overgrowth of the healthy bacteria in the vagina, and when the bad bacteria in the vagina outgrow the healthy one, this will now colonize bacteria and other things like the kind of soap you use, also your wet wipe. All this can also increase woman's chances of having this recurrent UTI. So as this happens, this can cause inflammations of the delicate part of the genital skin. And while washing away your vaginal secretion, especially women that normally use soap to wash, this can also destroy your healthy bacteria, which help to protect your vagina and stabilize your vaginal pH. And though this cannot increase your risk of UTIs. Other recurrent UTIs can run in family. That's to say, your gene can also raise your risk of having a recurrent UTI. Family, that is when you have a genetic factor, maybe it runs in the family, and this can be with a mild alter consistency of your urine, making you more susceptible to these UTIs. So remember that having a recurrent UTI, can be so worrisome. So knowing how to prevent it is very, very important. Now that you know the major things that normally raise your risk, like having sex, being a woman, raise your risk. Doesn't mean that men doesn't have it. Men can have it, but it is more high in women than men. So being a woman raise your risk, and also sexual intercourse also raise your risk, and the kind of personal hygiene you practice also raise your risk, and the kind of feminine product you use also raise your risk. Your gene or family background, or having one that having this issue running the family can also raise your risk. Cool. There are so many things that you cannot do to prevent these recurrent UTIs, and I'm going to talk about that in my next video. So thank you everyone for joining me and for listening, and don't forget to share this video in order to also pass this information to someone you love. Thank you, and don't forget to follow us on our page, Dynamic Health and Wellness, and also subscribe to my YouTube page, and also follow me up. Thank you, and have a blessed week. Bye.